Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts, and I'm excited to introduce you to a new podcast series in partnership with Lord Fairfax Community College. Having provided higher education and career training for the past half-century, LFCC is tightly interwoven into the fabric of the Northern Shenandoah Valley and Piedmont regions. Join me every week for conversations with current and former students to hear their funny and inspiring stories as we learn about their journey to higher education, the role that LFCC has played, where they are now, and where they plan to go. We'll also talk to current and former professors about their experiences and best memories of LFCC over the past 50 years. Get every single episode as they're released on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcast, Google Podcast, on Spotify, Amazon Music, wherever you listen to podcasts. Just search for LFCC Stories. Hello and welcome to The Valley Today. I am your host, Janet Michael. Happy Monday. As you are listening to the show today, we have pre-recorded our conversation with one of my favorite guests. Dr. Jeff Feit is on the Zoom screen with me. He is Valley Health's Vice President of Population and Community Health. Dr. Feit, I haven't talked to you for a while, and I'm sad about that, but that's kind of a good thing because it means things have been plugging along.
That's right. Thank you for having me again. It means things are getting back to normal. And we get to move on to more interesting things than COVID and COVID vaccines and the world we've been in for the last couple of years. Last year, feels like a couple of years.
I guess the big thing right now is that the CDC has approved, or the FDA has approved, vaccines for 12 to 15-year-olds.
Yeah, that's right. The process, if you remember, is that the FDA made a recommendation and they present that to a committee of the CDC called ACIP, the Committee on Immunization Practices. It's an independent panel that reviewed that, and they gave it the thumbs up. And Rochelle Walensky, the CDC director, signed off. The VDH, the Virginia Department of Health, endorsed it, and we gave our first COVID vaccine shots to 12-year-olds yesterday evening at our new site at the mall.
That is awesome. Y'all don't waste any time.
Truth in advertising. One of them was my 12-year-old. But yes, we didn't waste any time. And as soon as they announced it and it got the endorsement, we were right there.
Okay, so I have to tell you, when my son was 6 months old, I actually used him as part of a campaign that I was doing for immunizations with Kathy Narangis and Linda Robb. This is how old I am. I'm dating myself. But he was the immunization baby because we needed somebody that needed. I'm like, oh, my kid's due for his. And so I get you. I get where you're coming from there.
I'm a huge fan of Mrs. Robb. So nice to hear her name.
I think that this is probably going to be a huge step to getting kids back in school full time, is if we can get these kids vaccinated.
Absolutely. So, the schools have been amazing. They've been amazing since the beginning of the pandemic in their preparation and their execution. I've talked regularly with the superintendents and have just been, I just can't say enough about how thoughtful and concerned they've been. They've done it by the book, but with a passion for getting their kids back in school. I see my friends around the country whose kids were all virtual for these long periods of time. And was so proud to tell them, my kids have been in school the whole time. And yeah, it was 2 days a week, and now it's back to 4, and soon it'll be 5. But they've really been amazing. And yes, the thing that we can do that will make their lives better, and by their lives better, I mean make it better for the students, is to get kids immunized. The more kids we can get immunized, the more we know that we're not going to have spreads of disease. We're not going to have outbreaks in classrooms. We're not going to have outbreaks among teachers. And we're going to get back to regular stuff, regular school, regular sports, regular activities. And so it's super important that we get the community immunized. And by the community, I mean the kids as well as the adults, as soon as it's available. And my hope is that by the fall, we're all the way down to the age of 2.
Oh, wow. So that's already probably in the testing stages now then, I guess.
Yeah, they started the studies. We don't have the results yet. And, we follow the science. But I'm optimistic that the vaccines are going to be just as safe and just as effective in those groups as they have been in the other groups that have been tested.
Now, it's the Pfizer vaccine that's testing in the teens right now. Will all 3 of them ultimately be available for children?
We don't, right now I'm only aware that Pfizer is doing the studies. I don't know the status of Moderna and Johnson & Johnson, but it would be up to them to go ahead and do that work and, and prove that they're safe and effective in those age groups. But yeah, right now you're right. It's 12 and up for Pfizer.
So we're recording this on a Thursday afternoon. I got my second Moderna shot yesterday afternoon at Lord
Right.
Fairfax Community College. It was the last clinic that they were having at the college in partnership with ROTS because ROTS is going to go back to doing them at the pharmacy. You
Yeah.
guys have wrapped up at Shenandoah University, but now you're at the mall. So explain to me what's happening with where we're getting these vaccines.
It's good old supply and demand, right? So in the beginning, there was a supply shortage, and it was all really new, and so it made the most sense to do large vaccine events because we could aggregate expertise. There was lots of demand. We could create the right tracks to help people get through that quickly, get through efficiently, and we've done that work. We've vaccinated about half the adults in our community, about three-quarters of the seniors. And demand has slowed. And I want to encourage people to get the vaccine. I hope we talk about that a little bit, why it's so important to get the vaccine. But now we've moved to what we call our decentralization effort, which is you should be able to get a vaccine anywhere, your doctor's office, your pharmacy, some more drop-in clinics. The Department of Health has been so amazing at setting up these clinics in different places where they see a need. And then we are going to continue to have a presence here in Winchester at the Apple Blossom Mall. It's going to be open. It's right next to Victoria's Secrets at the H&R Block entrance where Sears used to be. It's open mall hours, Mondays, Wednesdays, and Saturdays. And part of that is to make sure that we have access for folks who may not have a primary care doctor. We've wanted for a while now to have more hours in the evening and on Saturdays to really make it as easy as possible for people who want to get vaccinated. You shouldn't have to take off work. You should be able to do it in the evening. And the one thing I was there yesterday, and the one thing I noticed about our signs is that it doesn't say the most obvious thing, which is it's free. The vaccines are free. You walk in, there's no cash register, there's no credit card swiper thing, there's no way to take money. We don't take money. It's free. And we do ask for people's insurance information, but we don't even bill your insurance. That's just part of the prep mod system that we have, that we ask for that. But if you don't have insurance, just say I don't have any, and it's still free.
Well, and it's important to reinforce the fact that it's free because I had a conversation a few weeks ago with a gentleman who was talking about scams.
Mhm.
And there were a lot of scams that were floating around when the vaccine first came out from people saying, hey, I can get you an appointment, but it's going to cost you XYZ. So
Yeah.
I don't think you can say that it's free enough so that everybody understands and realizes go get it. It doesn't cost you anything.
That's exactly right. And those scams we were the victims of those scams, right? They were stealing our appointments that we were trying to make sure that we could create an equitable solution so everybody had access to the vaccines. And lo and behold, people were signing up for tons of slots and cheating the system and then sort of giving those away in different ways. And we had some work to do to manage through that.
Well, it's interesting. The one thing that I keep coming back to is one of our very early conversations when we were talking about the vaccine. It may have even just still been in development. And we were talking about the fact you said that this is eventually going to become probably one of those vaccines that our kids just get. That it's part of the regular MMRs, all of that sort of thing. And now, as I'm watching how this has progressed, you were right. Not that I was surprised because, I expect that what you tell me is true. But do you see that as something ongoing like the flu shot and like children immunizations?
Yeah, sure. Right. So I'm old enough now to remember some diseases that don't exist, which is the coolest thing as a doctor, right? So I'll tell you two funny stories about that. So one is from my own personal experience, is chickenpox, right? You and I had chickenpox when we were kids. I'm sure you did. I did. Nobody gets chickenpox anymore, and doctors under the age of 40 probably don't know what it looks like. It just doesn't happen. It's a rare disease to get chickenpox. It used to be something that everybody got, uh, and then the other one was something which is a little more esoteric, a little more doctory. But there's a disease called Haemophilus influenza type B, and most people have never heard of H flu type B. But it was a common cause of infantile meningitis, and it was the primary cause of a rare disease called epiglottitis, which was life-threatening for children. And we all learned about it, and we were all taught it was a common cause of this terrible meningitis you had to look for, and this epiglottitis thing that you heard. And the vaccine came out, and I'll tell you in a minute why I know this. The vaccine came out in 1993. And I know that because I was an intern and I've never seen the disease.
That is cool. See, you
So in
guys
my
are
first 2
learning.
years of medical school, 91 and 92, it was the most common cause of a couple of different important diseases. The vaccine came out in 93 and I've never seen it.
Never seen it again.
I've never seen it.
Let's take a quick break. When we come back, can we reiterate how important it is to get this vaccine so that in 20 or 30 years, doctors under 40 don't know what it is and have never seen a case of it? Can we talk about the importance of doing that in the next segment?
Absolutely. Let's do it.
Okay, we're going to take a quick break. When we come back, we're going to continue our conversation with Dr. Jeff Feit. He is Valley Health's Vice President of Population and Community Health. We'll be back in just a couple of minutes.
Got a financial decision to make or a goal to reach, but you don't know where to start? You've come to the right place. Introducing Quick Money Chats with the Northern Shenandoah Valley Financial Education Program. Visit tinyurl.com/Quick Money Chat to schedule a virtual chat with a staff member or trained volunteer. We won't tell you what to do, but we will give you the tools you need to choose wisely. And because Virginia Cooperative Extension is part of Virginia Tech and Virginia State, your land-grant universities, you can be sure that our information is credible and trustworthy. And you'll know that we aren't trying to sell you something. Maybe you want to improve your credit score, or reduce your banking overdraft fees, or even figure out if you can afford to buy that car. Sorting through tons of information on the internet can be overwhelming, and sometimes it can be hard to know who to trust. Schedule a Quick Money Chat and get the information you need to take action. Go to tinyurl.com/Quick Money Chat and get financial education personalized for you.
Welcome back to the Valley today. I am your host, Janet Michael. Happy Monday. As you are listening to the show today, we have pre-recorded our conversation with Dr. Jeff Feit on a Thursday afternoon. He is Valley Health's Vice President of Population and Community Health. And Dr. Feit, I mentioned in the first segment that we're recording this on a Thursday afternoon. I got my second Moderna shot yesterday. Felt a little rough last night, a little rough this morning, but as the day is going by, it's really not that big of a deal. And it certainly wasn't anything that would cause me to think, oh, I shouldn't have gotten that second shot. But people are making those poor choices, I understand.
I'm glad you feel good. I'm glad your experience was mild. My experience was mild as well. The truth is real. The truth is that about 1 in 12 to 13 people will have what's described as a moderate reaction, which is a temperature as high as 100 or a little over 100, and body aches that they describe as as moderate or higher. So it happens. It's not an illness that's going to hurt you. It's just uncomfortable for a day or two. You can take some Motrin, it'll go away. But yeah, your point is well taken, which is that it's not a good reason not to get your second shot. So let's remember what the literature says. The literature says that your protection against coronavirus starts around day 7 or 8 after your first shot and becomes really, really good after 14 days of that first shot. But in order to have long-standing protection, and this is particularly true as we've seen more of the variants, it really requires a second shot. When people look at after 3 or 4 months, it's only about a 50% protection if you've only gotten 1 shot, but that's much, much higher if you've gotten 2 shots. I also want to throw out there, I'm thinking about how to talk about what it means to be protected by the vaccine. And there's so many numbers that get thrown around. So I'm trying to boil it down to 3 or 4 really important points. So you can tell me if you think this is, you're the communications expert. I'm just a doctor. So you tell me if you think this makes sense. So if you are a fully vaccinated person in the United States right now with the current variants that we see, getting a 2-shot vaccine gives you 99.999% protection against being killed by coronavirus. It is almost perfect. It gives you about 99% plus protection against even being hospitalized. It gives you 95% protection from having moderate disease. So that's symptomatic COVID, where you'll miss a couple of days of work, but probably don't end up in the hospital and certainly don't end up dying. Beyond that, if you get a vaccine and then you're getting tested every couple of weeks, either because you work at a nursing home or because you're a professional baseball player or something like that, well, we have these populations that are being screened even though they don't have symptoms. Then the protection is somewhere in the neighborhood of 70 to 90%. There's about a 10 to 30% chance. I know that's broad, but there's a couple of different studies out there. There are definitely going to be people, 1 in 5 people, who still get no symptoms but have a positive COVID swab at some point, even though they're vaccinated. It's not perfect. So 99.999 chance that you're not going to die, and a very, very, very small chance you're going to get hospitalized. 95% chance of having a moderate case of protection against having a moderate case of COVID, and about 70 to 90% protection about having COVID at all. And then the 4th bullet point is, if you're vaccinated, even if you are one of those people that gets a mild case of COVID or even a symptomatic or asymptomatic, whatever, your chances of spreading it to someone else are significantly less if you've gotten vaccinated. You still can, but it's about a 2/3 reduction.
Well, and the other thing too is masks.
Well, so let me just make sure we don't connect those things too much. So if you do get vaccinated and you turn positive, again, much less chance, but if you do, you got to wear a mask, you got to isolate yourself, and you got to take yourself out of the population while you're sick. Let's put that aside for a sec. Yes, If you are vaccinated, the rules are going to become much more lenient about masks. I got an email right before I came on this show. I have not validated this yet. But my understanding is Virginia is going to relax its mask mandate indoor and outdoor for vaccinated people soon, this week. So there's no question society is going to start to create rules for vaccinated people and rules for unvaccinated people, and they're going to be different. And I think that's right. I think that vaccinated people and unvaccinated people create different risks for others. Nothing's perfect. It's not 100%. If you're vaccinated, there's not 100% chance you can't give this to somebody. There's still a small chance, but it's much less. And I think society is going to start to move towards opening up in all kinds of ways for people who are vaccinated.
What about the Johnson & Johnson vaccine? We've seen it come and go. People are still a little hesitant maybe to get that, though it is the one shot, one and done. So I can see where that kind of gets a little touchy. Which one do I go with?
Yeah, and I think this is a personal choice kind of issue. So the Johnson & Johnson vaccine, again, is very effective at preventing death from COVID, very effective at preventing hospitalizations. It had this side effect, which is a little technical and complicated, but it was about a 1 in a million chance, a little more than 1 in a million chance of having a strange blood clot syndrome. And it was taken off the market while that was reviewed. It is about 1 in a million. Again, it's a little less than that. It's about 1 in 700,000, I think. A little more than that, I should say, 1 in 700,000. There were 15 cases all told. And that's a real thing. It's real. And the hardest thing in medicine to talk about is things that are real but small. It's real. Getting struck by lightning is real. It happens. It's just really rare. And this is like that. It's real. It happens, but it's really rare. You can reduce your chances of getting that to 0 if you get the Moderna or the Pfizer vaccine, but then it's 2 shots. Or you can take this very, very small chance. It's more common, by the way, in women between the ages of 15 and 50. I think there's 1 case in men. But it's much more common in younger women for reasons that we don't really know. And it's, like I said, it's a really unusual. It happens outside of COVID, but it's pretty rare.
Will you be offering all 3 of those options at the clinics, in the mall, and at the various doctor's offices through Valley Health?
We don't get Moderna for not for any particular reason, but the Moderna has been typically distributed through the health departments. We've typically gotten Pfizer. We do have some Johnson & Johnson, and right now we're trying to figure out how to use it in places where it's hard to get people back for a second shot. So whether that's discharges from the hospital, discharges from the emergency room, homebound population, we're doing that kind of stuff with the Johnson & Johnson. I think it's going to be easier for us. I'm not trying to set policy here. I'm just thinking what's likely. It's going to be easier for us to just have the Pfizer out of the clinics, because then we can always do 12-year-olds.
And that makes sense. My husband got the Pfizer. He acts like he's 12, but he's actually older than that.
I got Pfizer too.
Well, Dr. Feit, thank you for taking some time out of your day to kind of give me an update on vaxes across the Shenandoah Valley. I appreciate it.
Thank you very much for having me. Remember, www.valleyhealthlink.com to go find a vaccine. But it really isn't hard. You can go to your pharmacies, you can go to us, you can go to the health department, go anywhere, just get vaccinated.
We are going to wrap up our conversation today with Dr. Jeff Feit. He is Valley Health's Vice President of Population and Community Health. We got a quick update about the progress of vaccinations for COVID-19 up and down the Shenandoah Valley. Meet me back here tomorrow, a few minutes after noon, for Tourism Tuesday. It is Luray Page County's turn at the mic. We're going to have a conversation about beer with Jim Turner. He is one of the owners at Hawksbill Brewing Company. So I will meet you back here then.